Hello, and welcome to our latest installment of Spartans Step Up. This web series is coordinated by the Alumni Association of Case Western Reserve University. I'm Amanda Mahoney, Chief Curator of the Dittrick Medical History Center, part of the College of Arts and Sciences at Case Western Reserve University. Today, we're focused on how people are grappling with the idea of being safe and feeling safe as more pandemic restrictions ease. Our two panelists can speak to the public health side of what's safe, as well as the psychological aspects of feeling safe during this tumultuous time. Today's discussion is particularly relevant for those of us in Ohio, where Governor DeWine just announced the removal of most pandemic health orders on June 2nd. Joining us to address the public health area is Dr. Heidi Gullett. Dr. Gullett is the Associate Director for the Center for Community Health Integration, the inaugural appointee of the Dr. Charles Kent Smith and Dr. Patricia Hughes Moore Professorship in the Medical Student Education and Family Medicine. She's the Associate Professor at Case Western Reserve University. She's also the Medical Director for the Cuyahoga County Board of Health. Welcome, Dr. Gullett.
Thank you.
Our panel also includes Dr. Norah Feeny, professor at the Post-Traumatic Stress Disorder in the Department, the Post-Traumatic Stress Disorder Center in the Department of Psychological Sciences at the College of Arts and Sciences at Case Western Reserve University. Welcome, Dr. Feeny.
Thank you, Amanda. Happy to be here.
I want to point out that these are abbreviated biographies for each of these panelists. They are both very well established and very well known on our campus as experts in their field. I have a question for each panelist, and then we'll go to the questions that were submitted by many of you when you registered for the Step Up session today. We received many questions, and hopefully we'll get to all of them. Thank you so much for submitting them, and we will get to as many of the questions as is possible. So Dr. Gullett, you were one of the first panelists when the Spartan Step Up series launched in May of 2020. Back then, the pandemic restrictions had recently taken effect. What are your thoughts about the pandemic today? And can you reflect on how your thoughts now compare to your thoughts in May of 2020?
Thank you so much, Amanda. It's a really important question, and I've done a lot of reflection over the past few months and recent weeks, just considering the 1-year anniversary of the first cases here in Ohio, which occurred in our jurisdiction along with another on the same day. And then we were rapidly followed by loss of life. And so that was a really very profound time in recognizing the impact of community spread. And at the same time, we were dealing with a lot of fear in those first few months. Not that we don't have the fear now, but I know that's one of the things we're going to talk about today. And at that time, we didn't have widespread testing. We didn't have personal protective equipment. And quite honestly, we didn't know much about this virus. We knew that there were other coronaviruses, but they were different. This was different. This was a novel virus our immune systems had never seen. And so we were seeing tremendous impact in many different age groups and many different parts of the country. So there was just a lot of uncertainty a year ago at this time. And that was why Dr. Acton and Governor DeWine and many of the leaders in our state and other states put forth public health mitigation efforts to really protect the public, based on the science we had at the time, which was actually very insightful. What happened here in the state of Ohio protected a lot of people. And so when I think back on it, I think, wow, that was a lot of courage among our leaders. And we also have learned so much. Our science has evolved so rapidly. And we really have had a lot of different phases in the pandemic. And thinking about those early phases, which I just described briefly, moving into the summer where we had an explosion of cases and really had no idea how much higher those cases would get in the winter and how much more loss of life there would be. And so we really have walked through these different phases. But what I can tell you now is that even though I and many of my colleagues tried to remain hopeful, and there was a lot of great hope to hold on to, even in those dark times. We now have a vaccine, which is incredibly hopeful. It's just a miraculous development in our ability to fight this pandemic. And so when I got my first dose in December, I was really overcome with emotion, recognizing the gravity of receiving this marvel of science and recognizing the impact on others. And so now that, as of today, my 12-year-old just got her vaccine, and I was again emotional, right? It's just a new phase of hope for protecting everyone, even the most young among us. So I hope that little jaunt down memory lane kind of gives you a sense for what it's been like, the highs, the lows, but a tremendous amount of personal and professional growth for all of us, and a lot that we've learned about science and our ability to courageously work together in the face of adversity.
Thank you, Dr. Gullett. Dr. Feeny, what advice do you have for people who are currently wrestling with, who are excited to go out in the world again and participate in barbecues and so forth, but are also afraid to gather in groups again? Some people have been isolated for over a year. Some of us have been cooped up with our family, Some of us have enjoyed extra time with our families. So what kind of incremental steps, baby steps, if you will, would you advise?
Sure, that's a great question. Thank you. And I just want to build on what Heidi was saying. I mean, I think these scientific advances in the last year are sort of, they're our moonshot. It's really just unbelievable, the pace and collaboration that led to these efficacious, safe vaccines. And my 12-year-old is in line, and my 16-year-old has been vaccinated, and they're very optimistic about some kind of return to quote unquote normalcy. So for those who are beginning to adjust to going back to doing things, to coming out of isolation, I mean, as Heidi highlighted, we had a year of unprecedented changes to our routines, changes to our family work-life balances. Front care health workers really putting their lives and stress on the line daily. People who were struggling with isolation and losing important rituals and routines like graduations and marriages and funerals and things like that. And people have experienced great losses. But on average, I study destabilizing life events and stress-related mental health difficulties. And what I have learned over the course of my career is that on average, people are extraordinarily resilient, which doesn't mean that we haven't all been impacted by the pandemic in multiple ways with regard to our stress levels and mental health. But people are really, with support, able to bounce back quite well. So I would start there, that social support is something that we actually know is extremely protective as you try to adjust to new routines and do things that might feel a bit risky in the beginning. There are both review papers and a large literature suggesting that if you are stressed and if you are concerned about returning to, again, I'll use normalcy in quotes, seeking social support and talking about these things with others is really important. And that's obviously going to be easier now that we can ease some of our social restrictions and come out of our isolation. So taking things to your words in baby steps is also something that I would definitely suggest. This is a new normal. When my children watch TV, they say, why are they standing so close? They shouldn't be so close together. And we're going to have to all kind of renorm our sense of safety. And the way that you do that is to gradually do things that on average are safe. So if it's a barbecue, start with a small one, start outside, start with people who are vaccinated. Doing things, if it is, we'll come to this later, but returning to public transportation, maybe practice, go when it's not busy, if you have the flexibility to do those things. And I would also say for those, and I can come back to those points, but I would just add, we also know that the hope that Heidi was talking about and optimism are actually extremely important in stressful circumstances. And that looking forward with hope for the changes that will come with reduced isolation, I think is really important. My daughter hasn't left the house in a year and is scared. She's immunocompromised. And so I drove her around Case's campus last night. And I drove her around all the buildings, and she said, oh, we used to go to the art museum, and we used to go to the botanical gardens. And I said, yeah, we can start to do those things again. So really cultivating the hope and the recollection of the things that we used to enjoy and love. And I could go on, but I will stop there. I think that those are some key things. Social support, gradually approaching situations that are safe, and leveraging your safety, your masks, social distancing. We're not at a place where we can give those things up. I think that the rate of Ohioans who have started to become vaccinated is about 42% as of today. The rate in our country is about 36%. So we still need to be putting safety precautions in place in certain situations. So I'll stop there, and maybe we'll have more time to flesh some of those ideas out.
Thank you so much, Dr. Feeny. And I personally, and I'm sure our audience, appreciate the concrete examples that you provided in your answer. So as a historian of medicine, I want to add a little bit of context to this question, which is about vaccine hesitancy. So those of us who look at the history of vaccination and pandemics, and those of you in the public health field know that there is no one reason why people are hesitant to take a vaccine. It's a very individual set of reasons. It's an individual choice. And so you will have to generalize. What are some of the reasons that you've seen, Dr. Gullett, with patients who are reluctant to receive the vaccine, and how do you approach that person? How would you help someone who is on the fence work through the decision whether or not to get the vaccine?
Thank you so much for that question. It's a really important question, and as you said, it requires a lot of context. There are certainly quite a few reasons why people may not trust a new advancement in medicine or in clinical care. It's not limited to vaccinations. This just happens to be the one that is front and center for all of us. Sometimes it has to do with an understanding of the process and an understanding of the science behind it. And sometimes I find people that have very specific questions or very concerned about regulatory policy and the timing of moving through to using it outside of studies and experimentation. Sometimes there are questions about, well, if it's emergency use, that means that maybe it isn't safe, which is not the case. It is the way that we proceed through certain levels of evidence and certain levels of data. And I would add that the Pfizer company has already applied for full FDA approval of that vaccine, and Moderna will follow. They simply needed enough months of cumulative data from the original study participants to apply for that designation. But more importantly, sometimes this is related to a long history of historical injustices and populations in our community and communities across the country and the world who have been subject to unjust experimentation in medicine and clinical care. And there is trauma that goes along with that, and there is mistrust. And so one of the things I have found, both as a public health professional and as a clinician, is that the most impactful conversations I've had have been with people for whom we have a trusted relationship. And they're people who I've known for a long time. And sometimes it's a conversation over several visits or over the phone multiple times. I have reached out to patients, and then they send me another message and I call them again and we talk a little bit longer. Sometimes there are people that I've more recently met, but they're not sure whether to trust me or not, and that's fair. So I want to talk about the different reasons people might be hesitant, but also that the messenger is important. And I never want anyone to feel coerced or forced to take a vaccination or any other clinical intervention or recommendation in a clinical plan. This is about us working together and you having the right information to make the best choice for you and for your family. And so for me, it's about making sure that people have that information in ways that they understand and that all of their questions are answered when they have those questions, not in a month from now. The other thing I want to mention is that in prior pandemics, we haven't had the degree of social media that we have now. And so the complex dynamic of social media propagating information and misinformation cannot be underscored enough in this pandemic. And so trying to articulate complex scientific principles that have been politicized is often really difficult, but became really difficult in this pandemic. And so I have had a lot of really honest conversations with people across the political spectrum about the science behind this, trying to ensure that people understand the true data and they understand what's known and what isn't known. And the final thing I'll say is that I've encountered a lot of people who are worried about getting sick from the vaccine. But what I really try to differentiate is the difference between an adverse reaction or an allergic reaction to a vaccine. Those are very few and far between. And I've actually been looking at the data very closely about this since we started vaccinating in December. That is very different than your body having an immune response, which we expect. And honestly, I celebrated when I experienced, because it meant that my body's immune system was working and it was doing its job. And that when I get exposed to COVID, which has undoubtedly happened multiple times, I will have an immune response that's enough that prevents me from getting sick, and it prevents me from spreading the infection to other people who may not be vaccinated. So those are very different things. But I think a lot of times people think, I just got sick. Well, there's a difference. And if it's an immune response, it's short-lived and it's a really great thing, even though you don't feel good. And the last thing is just, I'm trying to also help people understand the protections they have in their jobs and employment, so that they don't, if they have to miss, they know they're protected. And there are certain policy level issues that people aren't aware exist to protect them. And so that's another piece of the vaccine education, because most people can't afford to miss work and not be paid.
Thank you so much, Dr. Gullett. Dr. Feeny, is there an aspect of that question that you'd like to discuss?
Yeah, I think Dr. Gullett did a fantastic job. And I think that while I'm not a public health expert, I would really give much of the same advice, that when we're hearing about vaccine hesitancy, we need to understand what that actually means and not make assumptions about it, and listen to why people are hesitant, and then address those concerns with the data that we have. And fortunately, the data that we have is quite compelling. Data isn't always enough, however, so that trust is, I think, really important. And I think that means that faith leaders, pediatricians, people in the communities in which people live, trust, and know can be instrumental in helping to discuss with their community members the pros and cons and the overall, really quite impressive efficacy and safety of these. And I think to Dr. Gullett's point about systematic disadvantage and abuse of certain populations, I think that also means we need to be very, very mindful to make these vaccinations available in places that are in people's communities, available such that if they do have to take off time for work, if they do have to get childcare, that these should be convenient. They should be places that are familiar. So, for example, some places are using churches and mosques, schools, pediatrician offices. And I think that is part of that trust and relationship that is really important here. And I think the other thing that I would say really quickly is, we also know that when we emphasize for certain groups that once you get the vaccine, you can stop doing some of these social distancing things that are really kind of leaving you to be isolated, that's really an incentive for people that reminding the positive side of doing this is that you can begin to resume things that you love, that are meaningful, that you haven't been able to do.
Thank you, Dr. Feeny. That was a beautiful segue into the next question I have for you, which is about changing gears once you've been vaccinated. So you used the term, which I really like, that the pandemic has been destabilizing for everyone. And in some ways, getting vaccinated is another destabilization of your norm, right? So how would you suggest, or how would you approach helping people support those who are vaccinated but not quite ready to go to that barbecue?
Yeah, that's a great question. Thank you. And I think it's really important. And I'll reiterate some of the things that I said in response to your first question, which is What we know about distress and what we know about anxiety and what we know about stress-related difficulties is that the default is to avoid and to keep ourselves safe and to keep, in this case, for a very good reason, to keep our risk down. And when we continue to avoid things, the distress that we're experiencing doesn't change. So in simple graded ways, again, like going to the grocery store, perhaps. I have elderly parents. I shopped for them for 7 months. Getting them back to the grocery store was getting them, making sure they had masks, making sure that they were there when it wasn't crowded, making sure that they understood the delivery system. And once they did that a couple times, they began to feel more comfortable. So taking graded steps to do the things that you used to do, while also obviously assessing your risk level and the risk in your community. Going to the grocery store when it's not crowded, eating outside at a restaurant for the first time, having coffee with a trusted friend outside, building up to events that might be more challenging. And I would also say, back to the example that I gave earlier, really cultivating activities that are meaningful to you. That's one way to kind of get back to life. Many of us had to stop things that we really enjoy, whether it be going to the gym, going to concerts, hanging out with our friends, and having those incentives of getting back to normalcy and actually understanding what people would like to reclaim. What is it that is really important for you? I can't make assumptions about what is important for you to get back into your life. Let's think about what that is and then find a way that you can do that in a way that's tolerable. But you also learn, I can do this. It wasn't as bad as I expected. And actually, it was nice. And those are really the principles that we use when we are working with people who have clinical symptoms. Back to your point, Amanda, I think, yes, for all of us, this has been a destabilizing life event. That doesn't mean that we are all necessarily experiencing psychiatric disorders or that we all need intervention, right? As I started out saying, people on average are really resilient. But getting back to being full-time on campus, teaching in classrooms, having full classrooms, eating in dining halls. It's going to take some time for people to adjust. And I think the other thing that I would say is give yourself some grace. That makes sense, right? We've been doing things differently for a year. It makes sense that people are apprehensive. That's the normal human response. And as you begin to gradually get back to things you enjoy, do things that are meaningful to you and or that you have to do, that sense of weirdness and apprehension should begin to diminish.
Thank you so much, Dr. Feeny. Dr. Gullett, during our conversation, you've done a wonderful job of melding science with policy and also understanding the reality of people's lives in a way that I find very impressive. So this is a great question for you. As we transition as we transition into less health restrictions and going out into the world more, how would you suggest that people start downgrading or adapting their some of the infection control measures that they may have taken, such as wiping down packages and groceries? How often should they be washing their hands? And is that advice any different for those who are fully vaccinated versus those who are not vaccinated?
Thank you so much. Really important practical questions as we all try to navigate this new phase of the pandemic we find ourselves in. So there was an excellent science brief that is a summary of the evidence around COVID-19 and the risk of COVID-19 on surfaces and on different types of surfaces, different types of things that was published online. It's on the CDC website. You could probably easily Google it. It's like COVID-19 and surfaces. It will probably come up in early April. And that was really helpful because up until then, we had bits and pieces of information from various studies, but they were all kind of in a lab, right? They're not like real life, right? And so we're kind of understanding how long does this particular virus, it's what we call an envelope virus. So it has this outer coating on it. And so some of the cleaning supplies we use break that down, so you get rid of it quicker. But if it's just sitting there with no cleaning supplies attached, how long does it live on this type or that type of surface? This really put it together very nicely, I think. And so there are a lot of factors to consider, but what's really important is that people recognize this is not going to be a light switch on and off. The pandemic is not ending on June 2nd, as we all know, but psychologically, I think we all wish it had ended a long time ago. And so the idea of, okay, public health orders for the state of Ohio will be lifted on this particular date does not mean that we should abandon all of the type of protections that we have. And I think Dr. Feeny's done an amazing job of really giving practical advice about people beginning to slowly phase back in to the things they love or the things that bring joy to their lives, but not just going out and doing everything all at once or expecting yourself to be comfortable with those changes. I'll give you one example. I had finally made my way to return to the gym and learn how to exercise with a mask on. And I have asthma and I was really nervous and I was like, but I'm vaccinated, I can do this. I waited till I was, more than 2 weeks out. And then my gym sent out a notice yesterday, like we're reevaluating our safety protocols. And I was in a moment kind of stopped in my tracks, like, hold up. I agreed to the safety protocols you have in place right now, right? So it was another example of like, okay, let me recalibrate myself. What am I comfortable with? I tested the waters. I've been doing this one thing. Now I need to think about what is the next step, right? And we're all going to have to do that in a lot of different parts of our lives. But I think there are a lot of things that go into it, and it'd be really important to continue masking, regardless of whether you're vaccinated or not. We have a lot of variants that are circulating in our community and in others. And what that means is that you have genetic variation in the virus, and it's going to continue to happen until we get a very high percentage of people vaccinated. Vaccinations are slowing down. So I don't anticipate, unless we have a dramatic increase in vaccinations in the next month, that we won't continue to have variants. Therefore, you still need to protect yourself. And the mask protects you and it protects other people. I live with an unvaccinated child. I don't know the timeline for when he'll be vaccinated. So I do these things to protect him. Other people ask about wiping down groceries, wiping down surfaces. Hand hygiene, masking, social distancing, all still really important when you're with people who are not part of your household. And so I just want people to feel that they have the power to still do those things. Just because you don't have to wear a mask doesn't mean you need to stop wearing a mask. If you feel comfortable, wear your mask. And it might be the right thing for you to do in a situation where there's a high risk of a possible infection. I would encourage people to look at the CDC website. They have a really nice infographic that goes through vaccinated and unvaccinated people and some common activities that we like to do. Really helpful. It's like red, yellow, and green. I learned a lot when I read it and, showed it to my kids and they found it helpful too. So hopefully that gives you some guidance on those pieces, but it's all about you and what you're comfortable with. It's not about suddenly changing what you do overnight.
Yeah, can I just build on that? I totally agree. And I would say from a psychological perspective, that's also really important that we all have a sense of, much of this pandemic has been so out of our control. And part of struggling and destabilizing life events is sort of, what can I do? And the levers that we have at this point, the controls that we have are the things that Dr. Gullett is alluding to, which is safety measures. I don't know if this is a rule to live by, but the recent guidance is you should be doing 2 out of 3. Outside, masking, social distancing, always 2 out of 3. So if you have somebody inside, you should be doing 2 of those things. And these are our levers of control that can help us feel comfortable and help us navigate entering situations that we may not have entered in the past 13 months.
Thank you so much. But Dr. Gullett, we have a question about historical transitions at the end of previous pandemics and how do they compare to our current situation? And I am more than happy to help you out with this question.
Sounds great. Do you want to talk about some historical context or at the beginning or just
Well, I will very briefly share that some of the sometimes historians and museum exhibits historicize epidemic disease and pandemics. And so, for example, that's the narrative around HIV and AIDS, right? That it was a pandemic that happened in the 1980s. Well, the HIV pandemic is still raging. You know, it is still a major public health problem. And so these are memory and the stories that we tell over and over again about previous pandemics, such as the 1918 flu pandemic and the polio epidemics of the late 19th century through the mid 20th century. These stories are important because they structure how people understand pandemics and their role as citizens and neighbors in fighting a pandemic and mitigating it. So rather than me going on and on about history, I'll mute myself for your comments.
Thank you so much. That is incredibly helpful context and perspective. So pandemics really change the way we live. Certainly for periods of time, they change the way we live, but sometimes there are lasting things that change. In the public health world, actually at the Cuyahoga County Board of Health, we have this really amazing wall that walks through 100 years, the first 100 years of our existence, which happened to be 1919 to 2019. And it started, after the influenza pandemic. And we walk through lots of really important public health events locally, nationally, and globally. And for me, that's so important because each time a pandemic or another major event happens, we learn about how to live differently. We learn about ourselves, but we also learn about how interconnected we are and how so much of what happened during this pandemic, we learned how to live in isolation, but yet connect in different ways that we aren't used to connecting. We wouldn't normally be having this kind of a venue, right? So, as we were preparing, we were talking about the ways we're communicating over Zoom. It's different. We've learned, very different ways of communicating. So I think that even though we've had many pandemics and, in the past century, this is our fourth, depends on what you consider, but generally speaking, this would be our fourth novel virus pandemic. So 1918, we had this influenza pandemic, and that affected, somewhere between 1% and 3% of the world's population. In the late 60s, we had the H3N2, and that was much smaller, about 0.03% of the population. 2009, we all probably remember that one, right? We got our H1N1 influenza vaccination, much lower even, 0.001%, or just a little higher of the population. But now you see this pandemic, very different, affected much different proportion of the world's population. The United States greatly affected, mortality pretty substantial. And it's really disrupted life in ways I couldn't have fathomed as a public health professional. But on the other side of that, there were a lot of things that accelerated during this time that we've tried for decades to get done. So even though there are a lot of negative things we could dwell on, data infrastructure, public health infrastructure, vaccination infrastructure, things like that, there are these really amazing things. Like we learned how to work together and fast track health policy around all sorts of things. And we're going to use that moving forward for all kinds of other health benefit. Right. So I think this is a very different pandemic than in the past, but the similarities are that our lives will never be the same, but hopefully we can hold on to the positive ways and things that we've gained and then prepare for, creating a structure that helps us be resilient and helps us stop something like this from happening before it ever gets to the unchecked level we were at earlier this past year.
Thank you so much, Dr. Gullett. Dr. Feeny, something that I've noticed as a historian and a retired clinician is there's a lot more attention being paid to mental health and emotional well-being during this pandemic. And one of our viewers is interested in learning more about the work you do with patients who are modulating trauma. And so could you speak a little bit about patients who are modulating trauma during COVID-19?
Sure. Yeah. Thank you for sharing that question, Dr. Mahoney. I think it's a really important question, and I'll make one tag point to what Dr. Gullett was saying before I address that directly, which is about this sort of pulling the positive forward. I think in terms of being resilient, and I think we should all think of resilience as something that we can build. It's a muscle. You don't have it or don't have it, right? There are ways to build resilience. And I've mentioned some of those: social support, being active, et cetera. But I think given the disproportionate disruption that this pandemic has caused, I think it's also really worthwhile on the positive side for people to think about, were there changes in their lives they want to hold on to? Were there things that they started to do differently, whether it be more time with family, whether it be taking better care of their bodies? And obviously in times of stress, many times we're not functioning optimally. But for many people, there may be things that they learned about themselves or their values or what's important to them. So for example, we've started a family tradition of taking a walk every night for a variety of reasons. And that's something that I really want to hold on to and has been really positive for my family. More directly to your question, Amanda, the principles that we use. So I'm a clinical researcher. I do clinical trials about how to most effectively help men and women who have experienced trauma and stress-related events, and what I'm calling more broadly destabilizing life events. And COVID certainly has been an extraordinarily destabilizing life event. And the principles, we have a large trial that's actually about to begin for men and women who have experienced destabilizing life events and have anxiety or depression symptoms. And the principles that we use to help people reclaim their lives, and I think that's what we're talking about here as well, right? Reclaiming our lives, reclaiming a sense of control, reclaiming a sense of mastery, reclaiming a sense that the world is safe, though it's not 100% safe, of course. And those principles include, again, systematically beginning to engage with the world. When we are depressed or sad or scared, we pull back in many ways. Engaging, active coping, doing, those are really powerful tools to cope with stress and trauma. And if you were doing that in a treatment, you do it very systematically. You might make a whole list of things that you're not doing because it makes you feel uncomfortable, grade them from easiest to hardest, and then work your way up with repeated practice such that it becomes easier and you learn you can tolerate it. The other thing is when people have experienced stressful or traumatic or destabilizing life events, I have done a fair amount of work at looking at what kinds of treatments do people want. And do they want pharmacological interventions? Do they want psychological interventions? And on average, people want to talk about the things that have happened to them. They want to talk about what they're experiencing. And I do think that, as family, friends, neighbors, community members, to the extent that we can create that space, that can be really helpful and again, kind of feed into social support. One of our best predictors of how well people adapt after stress and trauma is the extent to which they feel supported, to the extent to which they feel like there are people they can go to, that they have resources. So that's something that in either a non-clinical or clinical setting, I would really be wanting to address. And then also, kind of echoing a point I made earlier, what happens when we're stressed is not only that we have negative emotions, but often that we have a decline in positive emotions. And priming the pump of positive emotions is, as I'd argue, equally important. One really simple way to do that, one factor that has been found to mitigate risk after stress and trauma is exercise. Exercise is a very, very powerful way to change your mood, to cultivate positivity. And as I was saying, approach and engage, trying to approach across the board and engage in and savor and expect positive events. That's where that optimism comes in, is also facilitating resilience. So I'd say the same principles underscore what I would call natural recovery following stress and therapeutic recovery following stress with more interfering levels of mood and anxiety. Does that address that question, do you think, Amanda?
Yes, that addresses it beautifully. Thank you so much, Dr. Feeny. As Dr. Feeny has explained and framed for us so well during this discussion, this is a very stressful time. Even the positive changes are changes and they're stressful. And so situations that would have been kind of normal are now fraught. They're emotionally fraught. And we have the added challenge of misinformation and different levels of different sources of information about COVID-19 and the vaccine and safety protocols. So this is a joint question, and we'll start with Dr. Gullett. So one of these situations that we newly have to navigate are having unvaccinated visitors into your house. So visitors or contractors, folks to come in and do work in your house or to drop something off. So let's start with the health aspects of that. Is it safe to have someone unvaccinated in your house? And how should you approach that?
So thank you so much for that question. I think it's really important to remember what works to limit transmission. And what works are those things that Dr. Feeny was mentioning earlier that you have control over. So you don't have control over whether someone is vaccinated. You have control over whether you let them in your house, but you may need them, right? You may need them to help you with something. So it's really important to think about the risk as long as you control the things you can. So are you masked? Even if you're vaccinated, are you masked if someone outside your household is coming in? Can you stay distanced from that person? And are they masked as well? And then can you stay distanced from that person? And if not, what's the period of time? We know that in general, we do need a cumulative 15 minutes around someone who is infectious within about 6 feet. But we also know that masking dramatically reduces that risk of transmission, and particularly for people who are vaccinated. These are highly efficacious vaccines. The endpoint was around loss of life and around very serious infection requiring intensive care unit, hospitalization, those sorts of things. So yes, we have seen across the country a small number of infections after vaccination, but they've been largely very mild or even asymptomatic, meaning people got tested because they work somewhere and have to be tested a lot, didn't even know they had a positive case. So the chances of you, even if you get it, having a severe infection are low. But if you do those other things like masking and distancing if you can, cleaning surfaces, making sure that you're doing all of those things. Those are the kind of important safety measures that you can control and that will allow you to get back to life, handling the things in your household that you need to have a normal and stable life, and don't have this as another destabilizing event, but rather you're getting back to kind of business as normal.
Thank you. Dr. Feeny, your comments?
Yeah, so Dr. Gullett addressed that beautifully, and this is much more in her area of expertise than mine, but I will say I have a plumber downstairs in my living room because we had a massive leak and a hole in our ceiling. So I think the point about, what do you need and what do you value is also something to assess. If it was a little crack, I might have just let it go. But a hole in the ceiling and dripping water is a safety concern. And my spouse and I had this very conversation about vaccinations. And so we did exactly, and I, totally agree with Dr. Gullett, use the things that you can control. You can say, I don't want a worker in my home who's not vaccinated. You can have someone in your home and have masks. If you need to have doors open, again, I'm not a public health expert, but those are the things that we have control over to reduce risk of transmission. And we also have control over what our priorities are in terms of having people into our homes.
Thank you so much. So I've been signaled that we are running out of time. So here's a really important question. Can you address the safety measures for children under the age of 12? Dr. Gullett, can you please respond?
Absolutely. So we do know that children are affected by COVID-19. We do know that there have been hospitalizations. Unfortunately, we have had deaths, much lower than older individuals. If you compare it to the H1N1 pandemic, we know that older individuals had some immunity to it based on infections they'd had throughout their lives, which isn't the case in COVID-19. So we saw very high impact in older adults early, and they got vaccinated first. And now we're seeing a much lower median age of infection and higher rates of hospitalization in younger individuals and even children, including those under 12. So it's the same sort of safety measures we talked about earlier. And those would be the things that we've all know now. I mean, pretty much everyone is sort of an infectious disease expert these days around infection control, right? We know what hand hygiene is. Hopefully everybody knows to do it and doesn't forget when the pandemic wanes. We still need hand hygiene because it's effective for all kinds of infectious diseases, but also masking and distancing to the extent that they can. And I mean, I'm a mother. I have a 9 and a 12-year-old, and it's been gut-wrenching to see the limitations on the things that they love as children to do, but also knowing to balance those things with their priorities around their health. And that's a decision, that's a family decision, a parent decision. And so we continue in our family to educate them about those things. And I think that's helpful advice for everyone. These are the things you can do to protect yourself. And these are the things that you can do when you're going into a situation. We talk a lot about what you can control, like Dr. Feeny was talking about, in a very developmentally appropriate way. So they're really the same sort of things we say for adults, but kids need to have agency and they need to have ownership and feel that they can do those things. And that's really important. And there are, of course, always, things to consider. Children with developmental issues or kids who maybe aren't neurotypical and for whom masking is a real problem. Those are the things to talk with your primary care clinician or your specialty consultant about how to manage those things. But in general, infection control recommendations are the same. And we're hopeful that younger children will be vaccinated, hopefully by the fall or hopefully by the end of the year for sure. And that will be a game changer as well.
Thank you so much, Dr. Gullett. I have an 11-year-old and we're counting down the days. So Dr. Feeny, on the topic of kids, could you talk a little bit about how the pandemic has affected kids? And are there long-term issues parents should know about? And I'll give an example that the activities that are very meaningful for my son, playing basketball, he no longer wants to do. And that was why he was so disappointed with the age 12 cutoff.
Yeah, thank you. I think that's a really important question. And I have kids. I have a 16-year-old and a 12-year-old, almost 12-year-old. I wish he was 12 so he could be vaccinated, but almost 12. And they've been remote schooling for a year. And I think that, both the data and anecdotal evidence shows that this has been particularly hard on adolescents for a variety of developmental reasons. This is an age where, autonomy is really starting to emerge. And children and teens are becoming more and more connected to their peers. And the disruption of the social routines around school, the lack of the ability to socialize with friends. I think that social media in that case has actually been a lifesaver for many kids in terms of being able to text with their friends and FaceTime. And my son has a regular gaming time with one of his good friends. And they've been able to do that through the whole pandemic distanced. So I think, there are different risk and vulnerability groups for people with pre-existing mental health difficulties like depression or anxiety are more vulnerable to long-lasting impacts of COVID. But again, the data bears that out. There are increased rates of anxiety and depression and some bumps in suicide, though that's been up and down. But on the whole, I think I do still want to emphasize how resilient kids and adolescents are as well, and how creative they've been in coming up with ways to kind of get their social needs met. Losing sports, losing orchestra, losing proms, losing graduations. I think that's been really, really hard for teenagers and for children. And I think that it's our job as clinicians and parents and a supportive community to try to create meaning out of this, to try to create new traditions and to encourage our kids to begin again, to sort of, to get back to things If you've lost joy for something, one of my favorite tag words is cultivate joy. Joy is a seed that needs to be watered and nurtured. So try to begin to kind of cultivate joy around activities that might feel like, nah, I don't really want to do that anymore. I don't know if that directly addresses what you were asking about, Amanda. Could I augment that at all, or?
I think you covered that beautifully. I have found this session so helpful to myself personally. And really, we want to thank our viewers for your questions today. We could not have scripted better questions than those that we received. And a special thanks to Dr. Gullett and Dr. Feeny for their wonderful insight into everything the multifaceted challenges of the pandemic and of our next phase of living through the pandemic. We really appreciate your time and your expertise.
Thank you, Dr. Mahoney, for moderating. You were a fantastic moderator, and Dr. Gullett, it was lovely to speak with you.
Thank you so much for this opportunity. I've really enjoyed my time with both of you this afternoon, and thank you for the viewer questions. They were excellent.
So I want to thank our visitors, our viewers, again for joining us today. And if you have any additional questions or comments on today's discussion, you can pass them on to the Alumni Association, and the email address will be displayed up on the screen in just a moment. Thank you so much again, and take care, everyone.